Hello, Dr. Ashish and his team extends a warm welcome to you. We are glad that you have chosen CMARTS for your treatment to help you deal with whatever situations you are in currently. This is a disease education series that we run for all mental illnesses. We believe that in treatment of any disorder, patient education plays an important role, and that is the reason we have this disease education series. And in this series, we are going to talk about psychosis. What is psychosis? Psychosis is a mental health problem that causes people to perceive or interpret things differently from those around them. This might involve hallucinations or delusions. Individuals experiencing psychosis may have difficulty distinguishing between what is real and what is not. Psychosis can be a symptom of various mental health disorders, including schizophrenia, schizoaffective disorder, bipolar disorder, and severe form of depression. It can be associated with substance abuse, certain medical conditions, or as side effects of medicines. There are multiple diseases, visible even from far, some only when closely examined, while some requires internal examination and investigation. If a person suffers from fracture, it is visible even from far, but if a person suffers from jaundice, blood investigation will be required. Only close examination would tell if a person is suffering from a heat rash. Internal examination is required if an internal organ of the body is affected. But many a times, even after all the investigation, one may not be able to tell what is the problem. So in that case, what can be done? In such cases, one needs to see a doctor. So if you have heart disease, you go to a cardiologist. If you have bone related issue, you go to an orthopedic. Similarly, if you have a mind issue, whom do you go to? You go to a psychiatrist. And that's the reason why you are here at Dr. Ashish's clinic. He is a psychiatrist in practice for 30 plus years now. In this video, we shall be talking about causes, signs and symptoms and ways to deal with psychosis. There isn't a single cause for psychosis, and it often results from a combination of genetic, biological, environmental, and psychological factors. Here are some common factors that may contribute to the development of psychosis. A family history of psychosis or other mental health disorders may increase the risk of developing psychosis. Certain genetic factors may contribute to an individual's susceptibility. It is not caused by a single gene, but rather by the interplay of various genetic factors. It's also important to note that having a genetic predisposition does not guarantee the development of psychosis, but environmental factors, including prenatal factors, obstetric complications, stress, and drug use also play a crucial role. Therefore, one may note that the individual with genetic predisposition is more susceptible to develop the disease if exposed to specific environmental factors such as prolonged use of drug, prolonged stress, depression, and likewise. Let's see some of the environmental factors. Some of the environmental factors are various obstetric complications, which are issues during fetal development or birth complications like hypoxia, which is lack of oxygen, or prenatal conditions such as infections during pregnancy, particularly in the first and the second trimester. Inadequate maternal nutrition during pregnancy leading to deficiencies in certain vitamins and minerals, or exposure to environmental toxins and certain drugs during pregnancy, including exposure to substances like lead, nicotine, and certain illicit drugs, including alcohol and some medication, may pose risks. Cannabis use, especially during adolescence, has been linked to an increased risk of psychosis, and prolonged use of drugs can lead to schizophrenia, where symptoms are more persistent as compared to psychosis. Extreme stress levels during growing up years and or unhealthy environment during growing up years also pose high risk. It's important to note that these factors are not direct causes but may contribute to a complex interplay of genetic and environmental influences. The YouTube video that we are about to watch now shows us the brain chemistry in schizophrenia, which is an advanced stage of psychosis.
Schizophrenia is a potentially severe psychiatric condition that involves a variety of symptoms. The symptoms of schizophrenia are often categorized as positive, negative, or cognitive. Positive symptoms involve the development of a behavior or thought pattern that isn't normally present, such as hallucinations and/or delusions. Negative symptoms involve the loss of a normal function and include lack of motivation, blunted emotion, or difficulty experiencing pleasure. Cognitive symptoms are those that affect someone's ability to think clearly and include deficits in attention, memory, and/or concentration. The neuroscience of schizophrenia has been difficult to sort out, but a great deal of research has focused on neurotransmitter abnormalities at the root of the disorder. Dopamine has received much of this attention, with the general hypothesis being that dopamine activity is too high in certain parts of the brain in schizophrenia. This hypothesis was originally formulated based on the findings that drugs used to treat schizophrenia act to reduce dopamine activity, and drugs that increase dopamine levels, such as amphetamine, can induce behavior that in some ways resembles the psychotic states schizophrenic patients experience. The idea that increased dopamine activity plays a role in schizophrenic symptoms is now supported by a large body of evidence. However, dopamine irregularities alone do not seem to explain all the symptoms of schizophrenia. Glutamate abnormalities, such as dysfunctional glutamate receptors, also occur in schizophrenia, and these may be capable of accounting for some negative and cognitive symptoms, something that dopamine levels have been less successful in explaining. Additionally, it has been proposed that dysfunction in glutamate systems may precede and lead to the dopamine hyperactivity observed in schizophrenia. While it's uncertain what causes these neurotransmitter abnormalities to emerge in the first place, it's generally believed that schizophrenia can be traced back to disruptions in early neural development that occur due to the influence of both genetic and environmental factors.
This image depicts the slow degeneration of the brain in psychosis. The brain to your left is the healthy brain, while the one to your right is the degenerated brain. Psychosis may progress and result in schizophrenia. So, as we saw in the previous video, it's the imbalance in the neurotransmitters within the brain that results in the disease. The disturbed brain chemistry leads to various symptoms where some are positive symptoms such as delusions and hallucinations. They may see or hear things which others cannot. Some are negative symptoms like flattened affect, disorganized speech, inability to express appropriate emotions, and some are cognitive malfunctions like difficulty in making decisions, disorganized thought process, and poor judgment. We saw the causes, the symptoms. Now let's see what does it result in. These symptoms leads to certain deficits in areas of self-care where personal hygiene and understanding of emotions is affected. The other aspect is cognitive function, where problem solving, learning new skills, and challenging one's thoughts gets difficult. And social interaction, where social function, social acquisition, and competence is affected. How can they be helped? How to treat this illness? Well, pharmacotherapy plays a significant role here, along with counseling and support groups. Only use of pharmacotherapy, which is medicine, may reduce the symptoms, but for reintegrating the individual and helping them to lead a healthy life again. Counseling and support groups play an important role too. So, after all the above efforts, can one guarantee a complete cure? Well, like any other disease, even mental health disease have high chances of relapse. So, how can one prevent the relapse? It's by doing the following things. First and foremost, early detection. When you see your loved one's behavior drifting away from normal, seek help and get proper guidance. These patients will need combination of medicines, psychotherapy, self-management and other support in their treatment plan. Medicine and regular follow-ups for the same with your psychiatrist is must. Secondly, psychotherapy, which will help them learn new skills, cope with challenges they experience, and then support group, which helps them improve their social skills. Now, how is psychotherapy and support group helpful? Well, these patients start learning new skills which can help them get a job based on the skills developed. Their social interactions will help them improve their emotional well-being. One-on-one counseling can help them with their cognitive abilities where they'll be able to think for themselves, learn new skills. Besides this, regular exercise, eating well, managing stress, spending time with friends and family is also very helpful. These people, when receive psychotherapy along with group sessions, can manage to be of good help to their loved ones, like helping them in the kitchen, getting groceries, vegetables, going to the bank, and small little chores in and around the house. Psychosis impacts the entire family, and it's usually best if the entire family is involved in treatment. A family-based therapy or intervention can be extremely helpful. Thank you for watching this video. Hope it has helped you understand the illness a little better. For any further query, please feel free to get in touch with us. Thank you again, Team Siemens.